Okay, good morning class. It's me Laz Bosnit and today we are going to talk about the urogenital triangle. Last time anal triangle भइसक्यो हैन के कन्फ्युजन छ anal triangle मा Hello.
I know ma'am.
Okay, so we have already done this two slide also. Urogenital triangle, you know the boundary of the urogenital triangle as well. So anteriorly urogenital triangle is bounded by pubic symphysis, that is the lower margin of the pubic symphysis. Posteriorly we have the horizontal line that joins the ischial tuberosity, and on each side we have the ischiopubic ramus. And this also we have already so I have already taught you this one also. So what are the layer of the urogenital triangle? We have the skin, superficial fascia, then superficial perineal pouch, perineal membrane, deep perineal pouch, and the superior layer of urogenital triangle. So these are the layer. Now we'll move on to the individual part. So first we'll move on to the skin. So in the skin of the urogenital triangle, in male there is the raphe which is present in the midline, but in the case of the female, in the midline, the skin presents a median cleft that is known as the vestibule, and the female reproductive system has also been female reproductive system. So there the vestibule is present between the two levi majora. That's why in female the skin presents in a median cleft, whereas in a male the skin is attached with each other. So on the both the side right and the left side we do not have any median cleft. So that is a raphe is present in the midline. Now next is the fatty layer. Now just see in this diagram. So this one is the skin and this one is the fatty layer of the superficial fascia. So when you keep on tracing the fatty layer of superficial fascia, this fatty layer of superficial fascia will continue anteriorly with the fatty layer of the scrotum. So this one is the fatty layer. This will continue anteriorly with the fatty layer of the scrotum and fatty layer of the penis as well in the case of the male. So we can say this will be continue with the superficial fascia of the surrounding areas. Now next one, another important thing, this one is the important one. Next one is the Colles fascia. Now last time I have already shown you the Colles fascia. This green color part, this is known as the Colles fascia. And this Colles fascia is the strong sheath of the fascia and that is present across the pubic arch. So the attachment is across the pubic arch. And this one, this is the skin. This is the superficial fascia. This one is the Colles fascia. This is the superficial perineal pouch. You can see over here. This one is the superficial perineal pouch. And this is the inferior layer of the urogenital diaphragm, or also known as the perineal membrane. This is the deep perineal pouch. And this one is the superior layer of urogenital diaphragm. So these are the particular layer of urogenital triangle. Now we have already finished the skin, superficial fascia. Now next one is known as the Colles fascia. When you see the Colles fascia, you just see. So what are the Colles fascia will form the lower boundary of superficial perineal pouch. This will form the lower boundary of superficial perineal pouch. Now, what are the attachment of Colles fascia? On each side, this will be attached to the ischiopubic ramus. Now, when you see the behind one, can you see the behind? Opposite behind ma. So this fascia will continue with the lower layer of urogenital, inferior layer of the urogenital diaphragm or the perineal membrane. So these two are continuous with each other. But see in the anterior part, this will be get open. You do not have any attachment anteriorly. That means the fascia Colles fascia will continue anteriorly with the fascia of the scrotum. Can you see? This is the fascia of the scrotum that is containing the dartos muscle. And this is also continue with the fascia of the penis. Further, this will also attach and continue with the scarpa fascia. And you know the scarpa fascia of anterior abdominal wall. Thasa is scarpa fascia, Campers and the scarpa fascia. Now I'll tell you once again, this one, see, just focus on this part, Colles fascia. This is the Colles fascia. The Colles fascia Posteriorly, the Colles fascia is continue with the inferior layer of the urogenital diaphragm. Anteriorly, you can see anteriorly it will continue with the fascia of the scrotum containing the dartos muscle, Colles fascia. This will continue with the Colles fascia. Then it will continue with the fascia of the penis. Now anteriorly, this will continue with the anterior abdominal wall, the fascia of the anterior abdominal wall, that is the scarpa fascia of the anterior abdominal wall. Now when you see on the lateral side, the Colles fascia, can you see the Colles fascia over here? So this one is attached to this one. So this fascia is attached with the lower margin of the ischiopubic ramus. You can see this is the cut section of the ischiopubic ramus, and this is attached to the lower margin of the ischiopubic ramus. So is it clear the attachment of the Colles fascia? बुझ्यो अब Colles fascia को attachment हरु? Colles fascia को attachment फेरि यो मात्रै डायग्राम हेरे त Colles fascia मा. So this one is the Colles fascia. Anteriorly केसँग continue छ? Anteriorly this is continue with the fascia of the scrotum. Then it is continue with the fascia of the penis. Then it is also continue anteriorly and upward with the fascia, superficial fascia of the anterior abdominal wall, that is the membranous fascia or membranous layer of anterior abdominal wall, that is known as a scarpa fascia. It's going to continue, sir. But posteriorly, this Colles fascia is continue with the inferior layer of the urogenital diaphragm. Look at urogenital diaphragm. Continue. Now see lateral attachment. Laterally, this is attached to the lower margin of the ischiopubic ramus. You can see these are attached to this lower margin of the ischiopubic ramus. So this is the main thing which you have to understand. Iti नै हो यसमा. बुझ्यो अब? बुझ्यो. Now, so this is also same one. Now you just see, if this is the Colles fascia, then what is this one? This space is known as superficial perineal pouch. Superficial perineal pouch. Now can you see the muscles, vessels, nerve over here? So these are the muscles. Can you see the muscles? Nerve over here. This all will be the content of superficial perineal pouch. Now we have already finished the Colles fascia. Now we'll move on to the superficial perineal pouch. Now what are the upper and the lower boundary of the superficial perineal pouch? अब upper and lower boundary के भयो superficial perineal pouch को? So if you can remember this diagram, then it will be very easy for you. It will be easy for you to remember the boundaries. So superficial perineal pouch. So see, this is the superficial perineal pouch. Can you see this superficial perineal pouch? Now this is the space which is present between the perineal membrane and Colles fascia. भन्नु मिल्छ हैन अब? बुझ्यो यो? So this is the space which is present between the perineal membrane. You can say the perineal membrane as inferior layer of urogenital diaphragm. So perineal membrane has got another name known as inferior layer of urogenital diaphragm. Between the inferior layer of urogenital diaphragm and Colles fascia, we have got the superficial perineal pouch. Now see the boundary above. What is there? माथि के छ त? Above what is there? Perineal membrane. Perineal membrane, or you can say the inferior layer of urogenital diaphragm. Now see in the lower part, what is there? Colles fascia. Colles fascia. Now anteriorly, can you see anteriorly it is open. The superficial perineal pouch is open anteriorly. Now see the posteriorly. Posteriorly ke cha? Posteriorly it is closed. How it is closed? It is closed because the Colles fascia is continue with the perineal membrane. Can you see the attachment of both the fascia? Perineal membrane and the Colles fascia. This will form the posterior boundary. Now see anteriorly. Anteriorly it is open. अब यो open भएर कहाँ जान्छ त? Anteriorly it is open. It will continue with the space of the scrotum. Then it will also continue with the space of the penis. Now next one, it will also continue with the space present in the anterior abdominal wall. And when you are reading the anterior abdominal wall, I think you have come across the word known as the superficial inguinal space. Now this superficial inguinal space, if you recall that part, then superficial inguinal space is a space which is present between के को बिचमा प्रेजेन्ट हुन्छ superficial inguinal space. हेलो थाहा छैन superficial inguinal space कुन कुन लेयर को बिचमा प्रेजेन्ट हुन्छ भनेर hello can you hear me?
Yes, ma'am.
Okay, थाहा छैन superficial inguinal space. Now see, now you recall the layer of the anterior abdominal wall. You have the skin, then you have got the superficial fascia. The deep fascia is absent. The superficial fascia is again divided to one. One is known as the fatty layer. Next one is known as the membranous layer. Now just beneath the membranous layer, what will be the another layer of the anterior abdominal wall? कुन लेयर हुन्छ फ्याटी लेयर पछाडीपट्टि सरी सुपरफिशियल मेम्ब्रेनस लेयर पछाडीपट्टि
External oblique muscle.
Good. External oblique muscle. Now in between the, can you see the green color one? In between the membranous layer and the external oblique muscle, we have the particular space. That space is known as the superficial inguinal space. So this superficial perineal pouch will continue with the space present in the scrotum. It will continue with the space present in the penis, and this will also continue with the space present in the anterior abdominal wall, and that space is known as the superficial inguinal space. Okay. So why you have to know this one, because it has got clinical correlation. एउटा clinical correlation छ, I'll tell you later on. At last ma भनिदिन्छु. Or so when you have got okay, I'll tell you this one. It's the clinical applied anatomy also. So when you have got the rupture of the urethra, okay, when you have the rupture of the urethra below the urogenital diaphragm or below the deep perineal pouch, or you can say if there is a rupture of the urethra in the superficial perineal pouch, my urethra rupture भयो भने, the urine will collect it in the superficial perineal pouch. As this space is open anteriorly, the urine will also pass into the scrotum. It will also pass into the space of the penis, and it will also pass into the space present in the anterior abdominal wall, because this space has got relation with the superficial perineal pouch. That's why you have to understand this one. I'll repeat once again this one. If the urethra is ruptured in superficial perineal pouch, the urine will collect it in superficial perineal pouch, and the urine that is collected in superficial perineal pouch will spread into the space of the scrotum, penis, as well as in a superficial inguinal space in the anterior abdominal wall. But this will not move into the thigh region, because in a thigh region we have got the fixed attachment. Attachment, fixed attachment of the deep fascia of the thigh, and the fascia of the anterior abdominal wall has got the will extend into the anterior abdominal wall. Is it clear, this one, the superficial perineal pouch?
Yes, ma'am.
Now this one is the same thing, the green color, this one. Okay, so the green color, this is known as the collis fascia, and this one is known as the superficial perineal pouch. And whatever over here, you can see the content of superficial perineal pouch. So you can see the content. I'll tell you later on in the next slide the content of the superficial perineal pouch. Now can you see, when you keep on tracing the green one, you can see the space present in the scrotum. Can you see the space present in the scrotum over here? The space present in the penis, and the space present in the anterior abdominal wall between the scarpa fascia and the external oblique muscle. You can see the space. This space is known as the superficial inguinal space. Now what is the content? The content which are present in the superficial inguinal, superficial perineal pouch, superficial perineal pouch. So those are the erectile structure. Then we have the 3 muscles present on each side. That means we have altogether 6 one. We have the vessels and we have the nerves. Now, what are the erectile structure? Female reproduction, male reproduction. So, what are the erectile structure present in the female? थाहा छ? यो त पढ्यो होला नि फिमेलमा. So this one are the erectile structure which are present in the female. Now what is this one? यो के हो त?
Vestibule.
These are the bulb of the vestibule. So these are the bulb of the vestibule. This one is known as clitoris. And can you see one? This one, which is attached to the ischiopubis ramus. These are known as the cross or crura of clitoris. So you have the clitoris, then clitoris is there, then crura of clitoris is there. Now when you compare this one, when you see in this diagram also, you can see this one is the clitoris. This one is the crura of the clitoris on each side, and this is known as the bulb of vestibule. So in the female, bulb of the vestibule, cross of the clitoris and urethra. You can see the urethra also, and the vagina. So all these are present in the superficial perineal pouch in the case of the female. Now same thing is there in the male also. In the male also, the organ related with those structure. So cross of penis. Cross means is the singular one, so the plural we call it as the crura. Crura of the penis, then the bulb of the penis. Bulb of the penis, crura of the penis, these are the erectile structure present in the male. Those all are present in the superficial perineal pouch. Now, next one is the muscles. Now, the muscles which are present in the superficial perineal pouch are 3 on either side. So, altogether, there are the 6 one. Now, this one is the diagram of the female, and this one is the diagram of the male. So, in the female also, you can see this one beneath erectile tissue over here. This is the cross of or crura of clitoris. Now, the crura of clitoris is covered by one muscle that is known as the ischio-cavernous. Now, why this is known as ischio-cavernous? Because this is attached to the ischium, ischiopubis ramus attachment. So this is known as the ischio-cavernous. Now, next one is, so you just see this one, the bulb of the vestibule. The bulb of the vestibule is covered by another muscle that is known as the bulbospongius. So the bulbospongius, ischio-cavernous, these are the muscles present both in the male and the female. Now in the male also same thing. The ischio-cavernous and the bulbospongius. These are the muscles which are present over here in the superficial perineal pouch. Apart from this one, we also have got another muscle. Can you see the transverse muscles present over here? This is known as the superficial transverse perineal muscle. Now we have the 2 different transverse perineal muscle. One is the superficial one. Next one is known as the deep one. So the superficial transverse perineal muscle is the content of superficial perineal pouch. Our deep kosko content deep is the content of the deep perineal pouch. Right now, no need to remember the content of the deep perineal pouch. Later on, I'll tell you. So what you have to remember over here is we have 3 different types of muscle on each side: ischio-cavernous, bulbospongius, and superficial transverse perineal muscle. These are the muscle present in superficial perineal pouch. Is it clear, this one?
Yes, ma'am.
Okay. Now next one is we have the vessels. Now the vessels. Now just see this one. This one is the urogenital triangle, and this one is the superficial perineal pouch. You can see this one hole is the superficial perineal pouch. This hole. Now can you see the artery? So this one is the internal pudendal artery for the dividing into the inferior rectal artery and the perineal artery. Our inferior rectal artery was the content of ischiorectal fossa, because over here we have the ischiorectal fossa. So this one is the content of, this was the content of the ischiorectal fossa. But the branches, one of the branches of internal pudendal artery that is known as the perineal artery will pass into the superficial perineal pouch. You can see the perineal artery. So the branches of the perineal artery, posterior scrotal and the labial vessels two in number, the two posterior scrotal and the labial vessels, and the transverse perineal vessels. Now you can see over here also this one, the transverse perineal vessels. These are the content of superficial perineal pouch. Now see about the nerve. I have already explained the pudendal nerve. The pudendal nerve is mainly divided into three branches. One is known as a dorsal nerve of penis or the clitoris. Then we have the perineal nerve. Then we have the infrarectal nerve. Our infrarectal nerve was the content of के को content थियो infrarectal nerve.
Anal triangle.
Anal triangle मा पनि कसको content थियो?
Visceral fossa.
Ischiorrectal fossa. So inferior rectal nerve and the infrarectal artery. That was the content of the ischiorrectal fossa. Now over here, the perineal branch. Can you see the perineal branch of branch of the perineal nerve? Can you see the branch of the perineal nerve? So this one is the perineal nerve, which will continue as the posterior scrotal nerve. मैले अस्ति भनेको थिएँ नि हैन. Perineal nerve will be further divided into deep and superficial. The superficial will be the cutaneous nerve, is the cutaneous nerve, whereas the deep is the motor nerve. So this cutaneous nerve will continue as the posterior scrotal or the labial nerve. So this two posterior scrotal or the labial nerve, which is the branch of the perineal nerve, is the content of superficial perineal pouch. Apart from this, we also have got the perineal branch of posterior femoral cutaneous nerve. So this all are the content of superficial perineal pouch. These are the content. So what are there? So we have the erectile tissue, then muscles is there, vessels is there, nerve is there. Now in the erectile tissue, what is there? We have the bulbous spongious, then in erectile tissue, the vulva vestibule, then we have the bulb of penis, then cross of clitoris and the cross of penis. Mainly, those are the erectile tissue present in the superficial perineal pouch. Now the muscles covering those erectile tissue, ischiocavernous, bulbous spongious, and another one which is not covering the erectile tissue, that is the superficial transverse perineal muscles. These are also the muscle present in the superficial perineal pouch. Now in the vessels, we have the branch of the perineal artery. Then in a nerve, we have the branch of the perineal nerve, that is the posterior. Remember, this must contain in the superficial perineal pouch, then that will be enough for you. Is it clear, boy? Bujyo? Now next one, we'll move on to the perineal membrane. Now this one is the perineal membrane. The perineal membrane, it will form the lower boundary of deep perineal pouch. Deep perineal pouch ko lower boundary is formed by the perineal membrane. This is the strong sheath of the fascia that is present across the pubic arch, present between the superficial and the deep perineal pouch. Now we can see the triangle area over here. This is the triangle one. The triangle of the perineal membrane is also known as the apex, and it is directed anteriorly, which are interconnected by a interior pubic ligament. We have the pubic ligament that will be connecting this one. So the apex, so you can see this is the apex. Apex is continue with the, right? Just see this one. So what is happening over here? The apex of the perineal membrane. Okay. Just see this one. This one is the inferior layer of the urogenital diaphragm, or also known as the perineal membrane. Now this perineal membrane is continuous anteriorly and posteriorly with superior layer of urogenital diaphragm. That means superior layer of urogenital diaphragm and the inferior layer of the urogenital diaphragm, which is also known as the perineal membrane, is continuous anteriorly and posteriorly both. So continuous anteriorly and posteriorly. Now in this diagram, when you see this one, anteriorly, this part will get thickened. Some part of the perineal membrane will get thickened, and this will form the pubic ligament. So you can see this one is a pubic ligament. So this is Next one is posterior. So posteriorly, this one is continue with the superior of urinary diaphragm, and this is also continue with the collis fascia. Can you see? So अगाडिपट्टि के छ superior layer of urinary diaphragm र inferior layer of urogenital diaphragm continue छ, पछाडि पनि continue छ, plus collis fascia सम्म पनि continue छ. So this is the perineal membrane. बुझ्यो अब यो? Is it clear? Okay. Now, what is the structure that will pierce the perineal membrane? So this one is the structure piercing the perineal membrane in the case of the male, and this one is in the case of the female. Now, in the case of male and the female, so two posterior scrotal, can you see the posterior scrotal nerve and artery on each side? Over here also posterior labial nerve and the vessels on each side. Now, next one is the deep artery of the penis and the clitoris. So this one is the deep artery of the penis. This one is the dorsal artery of the penis. Over here also we have the deep artery of the clitoris and the dorsal artery of the clitoris. Now next, urethra is there on both male and female. That is present as a common thing. Now next one is in the case of the male. Can you see on the side of the urethra? Can you see the small dot on either side? This is known as the duct of bulbourethral gland that is only present in the male. So the duct of bulbourethral gland, which is only present in the male, and in the case of female, the vagina, which is present behind the urethra, and the artery to the bulb of the penis, and artery to the bulb of the vestibule. These are present. These are the structure which will pierce the perineal membrane. I'll repeat once again. The common structure which will pierce the perineal membrane in both male and female. Those are the common one. Those are known as the posterior scrotal nerve and artery, or the vessels on its sides. Then the deep artery of penis, deep artery of the clitoris over here, dorsal artery of the penis, dorsal artery of the clitoris, then urethra. Now another one which is separate in the case of male and female. That one is duct of bulbourethral gland. Next one is vagina, then artery to the bulb of the vestibule, then artery to the bulb of penis. So those are the structure piercing the perineal membrane. Now next one is the deep perineal pouch. The deep perineal pouch. So the deep perineal pouch is the space present between the superficial and the inferior or superior and the inferior layer of the urogenital diaphragm. Above we have got the superior layer of urogenital diaphragm. Below we have the inferior layer of the urogenital diaphragm, and anteriorly and posteriorly these are closed by the fusion of the superior and the inferior layer of urogenital diaphragm. Now on each side, the boundary is formed by the ischiopubic ramus, that is the inner surface of the ischiopubic ramus. So those are the boundary of the deep perineal pouch. यसमा के कन्फ्युजन छ सोध्नु पर्ने? के छ सोध्नु पर्ने डिप perineal? बुझ्यो है डिप perineal pouchमा?
बुझ्यो.
Okay. Now this one is the deep perineal pouch. So whatever over here, these are the content of the deep perineal pouch. So this is also the content of the deep perineal pouch, the bulbourethral gland. Now, so these are the content. We have the muscles, vessels, nerve, and other structures. So the muscles, mainly we have the two different types of muscle. One is known as a sphincter urethrae. Next one is known as a deep transverse perineal muscle. So the sphincter urethrae and deep transverse. Okay. So muscles, we have the sphincter urethrae and the deep transverse perineal muscle. So was अघिको superficial transverse perineal muscle थियो नि. So that was the content present in the superficial perineal pouch, and this is the deep transverse perineal muscle present in the deep perineal pouch. So you can see in this one, we have the sphincter urethra. Can you see? This is the deep perineal pouch present between the superior layer of urogenital diaphragm and the inferior layer, and this is the sphincter urethra. And next one, can you see another muscles present over here, which is present transversely? This is the deep transverse perineal muscle. So these are the two muscles present in a deep perineal pouch. Now next one is the vessels. Deep artery of the penis, clitorius, dorsal artery of penis and clitorius, artery to the bulb of penis vestibule, and urethral artery. Those are the vessels present over there. Nerve, dorsal nerve of penis and the clitoris, and other structure are the membranous urethra, bulbourethral gland, and the vagina behind the urethra. So this one, can you see the gland? Can you see this one, the bulb of the bulbourethral gland? This one is the bulbourethral gland, which is also the content of the deep perineal pouch. Now, apart from this, dorsal nerve of penis over here, the dorsal nerve of penis. Now, over here also you can see the dorsal nerve, a dorsal artery, and the dorsal vessel of the penis and the clitoris. So all those structure and the bulbourethral gland, this all structure are present in deep perineal pouch. So deep perineal pouch main content याद गर्नु पर्ने भनेको, you have to know about the two muscle, sphincter urethra and the deep transverse perineal muscle, then dorsal artery, dorsal vessels, nerve of penis and the clitoris, bulbourethral gland. Now, superior fascia of the urogenital diaphragm, that is attached to the inner surface of the supraepigramus, and that is continue both anteriorly and posteriorly with the perineal membrane. The next is the urogenital diaphragm. So the urogenital diaphragm is the musculofacial partition, and that is mainly formed of the two muscles. Same muscle, जुन muscle is the content of deep perineal pouch, त्यसले नै urogenital diaphragm बनाउँछ. यो कुरा याद गरे है. So this one is the urogenital diaphragm. So urogenital diaphragm is the content of deep perineal pouch. This thing you have to remember. So what are the muscles which will form the urogenital diaphragm? Same muscle, the sphincter urethra and the deep transverse perineal muscle. And above we have got the superior fascia of urogenital diaphragm, and below we have the inferior fascia of the urogenital diaphragm. Now, what are the structure that will pierce the urogenital diaphragm? So this one is the urogenital diaphragm. In the case of female, vagina and the urethra will pierce. In the case of the male, only urethra will pierce the urogenital diaphragm. So these are the axon of the urogenital diaphragm that will support the bladder, that will constrict the vagina, and the sphincter urethra. This is the voluntary muscle which is under our control, and that is mainly controlling the micturition. Now, next important thing is the perineal body. Last time my question so that exam like perineal body भन्नुभएको थियो नि हैन. So the perineal body is present over here. This is the perineal body. This is the fibromuscular tissue which is present in between the anal triangle and the urogenital triangle over here. Now this perineal body ma almost we have the 10 different muscles on either side. 10 different muscles will present attached to the perineal body. Your perineal body ma 10 muscles will be attached to the perineal body. So what are the how those muscles will attach? In the deep layer we have the levator ani. You can see this levator ani is attached to the perineal body. Now in the intermediate layer we have got the sphincter urethrae, the sphincter urethrae and the deep transverse perineal muscle that is attached. Then external anal sphincter. In a superficial layer we have the bulbous spongious, then superficial transverse perineal and external sphincter. Now you can remember in this way also, no need to remember in layer wise. You can remember, you have to name the muscles which are attached to the perineal body. So in the perineal body, one is external anal sphincter, one. Now next one is we have the superficial transverse perineal muscle and the deep transverse perineal muscle. Next one, levator ani, then bulbous spongious, then we have got over here sphincter urethrae, that is also the sphincter urethrae. So these are the muscles which will be attached to the perineal body. So over here, the perineal body, can you see superficial and the deep transverse, external anal sphincter, levator ani, and the bulbous spongious and sphincter urethrae. So all these muscles are attached to the perineal body. Now this is, you may log in whenever the urethra is ruptured in the superficial perineal pouch, what will happen? So this is the same thing. I'm not going to repeat this one. Now what will happen when there is a rupture in the membranous urethra? So when there is a rupture in the membranous urethra, then the urine and the blood will collect it in the deep perineal pouch. Our deep perineal pouch ma collected bhayo bhane the fluid may pass superiorly and they may pass distribute into the extraperitoneally around the prostate and the bladder. Now when there is the absence of support provided by the ischioanal fat or ischiorectal fat, then rectal prolapse may occur. Perineal body, the perineal body will give support to the pelvic organ. If there is the damage to the perineal body, then the uterine and other viscera can prolapse. Now, ischiorectal fossa and the infection. Whenever you have the infection in the ischiorectal space and the perianal space, those are the most common site of having infection. Now, as these spaces are closely related with the anal canal, then whenever you have the abscesses may get ruptured and that may open into the anal canal, forming the anal fistula. अब इस्योरेक्टल स्पेसमा पेरिएनल स्पेसमा इन्फेक्सन भयो भने त्यो एब्सिसेसहरु कहाँनिर जान सक्छ anal canal open हुन सक्छ. That will form a tunnel like structure that is known as the anal fistula. So this is all about the perineum. Please सोध्नु पर्ने